This is Kelly Sadler with the Washington Times Politically Unstable. Today, I am joined by Dr. Frank Contacessa, who is an internist at the Custom Care Medical, and we're going to be talking all things MAHA. The MAHA assessment was delivered last week by the administration. RFK Jr. Just to get started here, there were some errors, some AI errors in the official report, which distracts, I think, from the key findings and what, RFK Jr. is really trying to do here within the administration. But like for some top lines out of the MAHA assessment, some concerning details. They point out that today, the U.S. is more than 1 in 5 children in the U.S. More than 1 in 5 children in the U.S. over 6 years of age is obese. And that's a 270% increase from the 1970s. The prevalence of prediabetes in teens has more than doubled over the last 2 decades. Childhood cancer incidence has risen nearly 40% since 1975. Teenage depression rates have nearly doubled. And between 1997 and 2018, childhood food allergy prevalence has risen 88%. As a mother of 3 boys, I'm concerned about this trajectory our children are on in this country. And the report breaks it down into several factors for this: is poor diet, environmental toxins, insufficient physical activity among the youth, stress, and then over prescribing a lot of these kids different drugs, whether it be for anxiety, ADHD, etc. Dr. Frank, I'd like to get your perspective on this report, and does it track with what you're seeing in your practice?
Well, Kelly, thanks for having me on your podcast. This is such an important topic to talk about. And what I love about the approach that RFK and the MAHA movement is making is that it's attacking it on a multifactorial level, because the causes of these problems and the statistics that you just cited are absolutely astounding. They are so striking because, when we were kids, this stuff didn't exist. I remember maybe there was one overweight kid in our class that, used to get made fun of. Too bad. But, most kids were lean and healthy. They ran around. They played. You didn't have to worry about bringing a dessert into the school because, half the kids are definitely allergic to peanuts or something like that. So something has clearly happened. And I love the fact that they're breaking it down into these at least 4 categories to approach. And within those categories, there's lots of other things that we can look at. So I'm really excited about this whole report because it's starting the conversation to, number one, admit that there's a problem, because I think a lot of people have just cruised along for the last several decades saying, what are you talking about? There's no problem. When we see our kids overweight and unhappy and just living less healthy lives. So I think the approach here is great, because it's those 4 big categories in which we can break down a little further. But overall, this is a very positive move.
No, absolutely. And it's starting the conversation. It's a conversation that we haven't had, but I think parents of children know exactly what RFK Jr. is talking about. Not the peanut allergy is one of those that all of the snacks that go into my children's lunches can't have any sort of peanuts in them because of all of the kids that have those allergens. And with boys in particular, I found a rise in ADHD. My children aren't on any ADHD medication, but it seems like all of their friends are. And if they act up in school, teachers are very quick to come to the parents and say, oh, I think your child might have an attention deficit disorder. Just digging into that alone, what do you think the cause of that is?
The first place that I would look is the food supply, and it's really the top line item on the report is looking at the exposures through food. We have glyphosate, we have atrazine, we have the colorings, the petroleum-based food colorings, yellow dye number 5. This is our kids' food is ultra processed. It's unhealthy. It doesn't come from a farm. It comes from a factory. We don't know what these chemicals do. Actually, we know some of the things that they do, and which is why so many other countries in the developed world ban a lot of these chemicals that are sprayed all over our kids' foods and are included in so many, their snack foods, their breakfast cereals, the produce, even the wheat and the oats that you might give a kid oatmeal, but it's completely contaminated with glyphosate. So it's more than just one thing. And it's hard to just say, hey, listen, we have to do this, make this one change, and then everything's going to be okay. This is a complete overhaul of the way that we eat, where we get our food from. And even I think we have to go in and educate parents and teachers to say, wait a second, and even doctors, because you could take a kid to a pediatrician and the first thing they want to do is to put them on medication because nobody has the time. Here's another problem is that doctors don't have the time to dig into problems. They have 5 or 10 minutes with you and they're out the door. So what's quicker, to counsel a parent on how to feed their kid, or to say, you know what, here's a prescription for an antidepressant or for Adderall or Ritalin. So there's another level of a problem, is because the medical system, we have a sick care system instead of a health care system. We don't attack the underlying causes of problems. We try to treat them with medications and pharmaceuticals once they arise.
That's absolutely correct. I mean, what advice would you give parents to help avoid some of, these problems that were highlighted in this medical assessment, to combat obesity, to combat, food allergies, to combat ADHD, to lower depression rates? I mean, it is a huge problem. But as a doctor, like, what advice do you give, concerned parents over their children?
Ellie, that's a great question. And the good news is it's pretty simple, and we all know what to do. Number one, I think it's really important to spend the extra money to buy organic food. We did this a couple of years ago. If you would have told me 10 years ago that I'd be the person, scanning labels and saying, nope, we can't have that, I would have said, I think you're a little crazy. But I believe that spending the money on organic food, and even that's not a guarantee, but it's got to be better than what's out there that haven't been sprayed with these synthetic chemicals, the weed killers and all this stuff. So number one, start with spending the extra money for organic food, organic dairy products, the milk, the yogurt, all that stuff should be organic. There's hormones in non-organic milk. There's growth hormone, there's antibiotics, all these terrible things that are endocrine disruptors. So number one is, when you shop the perimeter of the store, fresh fruits, fresh vegetables, fresh meats. Avoid the processed food in the interior of the supermarket. So that's number one. Number two, we have to cut down on the device use with our kids. And I even have I have 2 teenage daughters, and you have to pry the phones out of their hands, but you got to do it. Because they're spending hours and hours attached to their devices, social media. It's physically unhealthy. It's emotionally unhealthy. Kids are so addicted to social media. They're trying to please some mysterious friends that they have that aren't really friends. They're just these followers looking to see what they're doing in their lives. So get the phone out of their hands and kick them in the backside, not physically, but push them out the door so that they go out and play. Get some sunshine, get some physical activity. Honestly, get back to the way that we were raised, 30, 40, 50 years ago. Because if you looked at a photo of a beach from the 1970s, try to find an overweight person. Everybody was lean. Everybody was healthy, healthier anyway. So I think for parents, the simple answer is get back to basics. Cleaner, better food, make them run around, get the phones out of their hands.
Yeah, no, I mean, it's very simple, but in today's society, I think it's very difficult as a parent. As we sit here, one of my boys is on his device because there's no school today, and it's like, what do you do? Get out, get playing. But I want to talk to you about another trend that's happening, and it feels like everyone's on a GLP-1 for weight loss, rather than going out and getting the physical activity or buying the organic foods and eating healthy. This seems to be a quick fix for a lot of adults, as well as, starting to get prescribed to teenagers who are overweight. What is your take on GLP-1s?
Great question. I have this conversation at least once or twice a day with patients, as well as having done a lot of news stories on Newsmax and other channels about the GLP-1s. So let me start off by saying that I prescribe these drugs. I think they have a place. I think they can be a useful tool in the properly selected patient. I take a lot of time to select the patients that I will put on these drugs. I do a lot of lifestyle counseling because I have a concierge medical practice, which means I have more time to spend with patients than traditional practice. So I'm not in and out in 5 or 10 minutes. I can spend a half an hour or 45 minutes, which it might take that long to teach somebody how to eat properly, how to exercise properly, and how to avoid having to take medications like this. That being said, I do have patients that I think have tried everything, or they're diabetic or pre-diabetic. And I do think that GLP-1s are actually pretty good diabetes drugs. I get a little bit hesitant in the person, they have to lose 15 or 20 pounds. They're not diabetic. They haven't really tried to their best effort on diet and exercise. And I'm like, listen, let's give it 3 months. Here's what I want you to do. I give them a program. If they fail at that, or, they haven't had the kind of success, then I say, okay, maybe we'll talk about it. And you have to take the time to explain the pluses and minuses, because there are minuses. I certainly don't think that any teenager should be given a GLP-1 drug just out of convenience. I think any kid, especially with a young metabolism, has the capacity to do this naturally. With the proper nutritional counseling and exercise, there's no kid that can't get healthy. Again, that conversation changes a bit as you get older, and they can be properly used, but you have to do the proper nutritional counseling. We've all seen people go on these drugs and they lose weight, and then their face becomes drawn and they lose muscle mass and they look like somebody let the air out of their balloon, and they don't look healthier. They actually look sicker, even though they've lost weight, because nobody took the time to talk about proper protein intake and exercise to maintain your muscle mass when you're taking one of these drugs. So you might lose 20, 30, 40 pounds, but you lost a lot of your muscle instead of just losing fat.
And what are the studies of their long-term effects if a person does not have diabetes? Do we know kind of what the downside is, years from now, based on the usage of these drugs and the popularity of them right now?
We have some long-term data. The GLP-1s have been around for about 10 or 15 years in one form or another. They were not terribly popular until recently. They were used in poorly controlled type 2 diabetics for the last maybe 10 or 12 years. So we have some long-term data. The long-term effects, as far as I can see, have to do with gastrointestinal effects. I have seen some irreversible gastroparesis. So one of the ways that these drugs work is, and they work on a couple of different levels. One of them is to slow down your gastric motility. So when you eat, for about an hour after you eat, your stomach starts to churn to help break up the food and start the digestion process. After about an hour, your stomach empties out, almost like the toilet flushing. Everything that you ate moves along into the small intestine and then eventually the large intestine. These drugs slow down that process. So instead of an hour of churning and then you empty, it slows down the churning, and you might stay full for several hours after you eat. So number one, you're going to eat less because you're going to feel fuller longer, but it slows down the whole process. And it can cause constipation and abdominal cramps and things like that, which are usually reversible if you stop the drug, but not always. There are reported cases, and I've actually had one where the gastroparesis was irreversible. And that's a real problem. Thankfully, it's rare. It doesn't happen a lot. You also have to be very careful, and I don't see enough prescribers making sure that the patient has no family history of certain types of cancers, which can be increased with GLP-1 drugs, medullary thyroid cancer, MEN2, which is multiple endocrine neoplasia. They're relatively rare cancers, but taking these drugs can actually increase the risk that someone's going to get these cancers, increase risk for pancreatitis and things like that. Excuse me. These are thankfully relatively rare. And if you take the proper precautions and give the proper counseling, you can mitigate those risks. But most doctors don't have the time to do that. Many patients are going to these medi-spas to get them because it's cheaper. They might get a better deal. You might get some from a compounding pharmacy, but they certainly aren't taking the time to do it properly.
That's scary. And then, of course, once you go off these drugs, most people gain the weight right back. I want to talk to you about some of the more controversial aspects of RFK Jr. and things that he's highlighted, vaccinations being one of them. Now, he has stated that he is not anti-vax, that it's up to the parents to decide what vaccinations they choose to deliver to their children. But in terms of vaccination, and especially vaccinating our babies and our youth, what ones would you recommend that are needed and essential for a healthy lifestyle, and then other ones that perhaps aren't needed. The COVID vax is
Sure.
first that comes to mind among
Yeah,
the children.
this is a complicated and emotionally charged topic.
Hmm.
And well, let me start off by saying I don't recommend the mRNA-based COVID vaccines for
Oh wow.
anyone at all. I don't. I tell my patients to never again get a COVID shot. I think the mRNA technology is has more problems than benefits. I think the immunity offered by the mRNA vaccines is transient and inadequate, and the risks greatly outweigh the benefits. So I think certainly no child, and I don't even have any of my patients, young, old, or in between, get mRNA based COVID shots. As far as the traditional vaccines, and I did this with my own kids when they were young, they had all of their routine childhood vaccinations, which I'm grateful that they're kind of through the process because I might have some second thoughts about certain things at this point. Number one, I would tell parents to spread out any routine vaccinations. You'll go into a pediatrician's office and they'll want to give 3 or 4 different vaccines all at once and just start jabbing the baby's leg. I don't recommend that for a couple of reasons. Number one is if you have a reaction to one of the vaccines, you'll never know which one it was because you gave 3 or 4 that day. Number two, anybody's immune system, let alone an infant's, isn't prepared for that type of a load, of an immunogenic load at that age. So I would recommend that parents spread out childhood vaccines. You might delay something like a hepatitis. They want to give the hepatitis vaccine right away, hepatitis B vaccine right away. Hepatitis B, the only risk factors are bloodborne bodily fluid contact. So if you're not doing IV drugs or being promiscuous in your infancy, then you really don't need the hepatitis B vaccine. That can wait until later. You want to look at things like polio. I think MMR is reasonable at a young age, and again, with the doses being spread out. So I think parents should know that the traditional vaccines, as long as what's in it is what they say is in it, because I also have concerns about contamination and about changing the formulas. See, one of the things that RFK is talking about is that it's not so much the vaccines themselves, because listen, our generation I'm 50 years old. Our generation was loaded with vaccines, but they didn't contain some of the additives that you're seeing today. They're called adjuvants, ADJVUANT. An adjuvant is an additive that is supposed to increase the effectiveness of the vaccine. In other words, make the vaccine work better. But you know what they use? Aluminum. Aluminum is a heavy metal, which is a known neurotoxin that crosses the blood-brain barrier. And they've been doing this since the 80s. In the 70s and early 80s, when I grew up, they weren't in the vaccines. But now they're doing this, and it's supposed to be, they're called adjuvanted vaccines, and most of the childhood vaccines are. So one of the things RFK is doing is saying, wait a second, we don't have any safety data on this because since the late 80s, they haven't done safety testing because it became impossible to sue these companies because all of the liability was taken away. In the late 80s, just briefly, the Reagan administration, which I generally really like, said, you know what, the companies were going to stop making the vaccines because they became less profitable. So let's remove their liability so that the companies can make the vaccines. But by doing so, we don't have the safety testing on these adjuvants, which may be causing some of the problems like autism and ADD, ADHD that we're seeing today that we didn't see 30, 40, 50 years ago. So RFK is saying, if the data plays out that it's safe, great. But if there's a problem, then let's stop doing that, please.
Yeah. No, how do you, as a parent, going into the pediatrician, you have to go in every several months with a newborn. And then there's a shot cycle. How do you know if the shots that your baby's receiving has these chemicals, or do they all have them now, these adjugens, or how do you say that?
Adjuvant.
Do all of the modern day vaccines have these?
Most of them. Okay. Most of them do. Most of them do. And the problem is that pediatricians are paid bonuses for having fully vaccinated populations. So if a pediatrician's practice can have a certain level, like 85 or 90% of their patients fully vaccinated according to the schedule, they get relatively large bonuses from pharmaceutical companies. So they will often kick you out of their practice if you don't want to get all the vaccines, because you're going against their statistics and making it harder for them to get their bonuses. So it's hard. You can try to find pediatricians who will work with you and not kick you out of their practice if you don't want to follow the schedule exactly and pick and choose.
Well, what you just said is so important. And that's why the work that RFK Jr. is doing is so important, is because he's unafraid to take on, these big interests, the big pharma, for example, and the food lobby, for example, and breaking everything down, the way the system is structured for physicians to be getting paid bonuses by pharmaceutical companies to fulfill this vaccination schedule. All of this is corrupt, and it's corrupted by big money and heavy lobbying and major interests that this administration, for the first time, seems to be challenging. And we're already seeing some within the industry adapt to some of these guidelines and regulations. Some big fast food chains changing the way that they, do their French fries, or the colors and the dyes that they use in some of their products. So I think all of this is good. I think questioning the science is also good. That's something that during COVID we were not allowed to do, which I think made a lot of people skeptical of the science. And all of us that have children are seeing this epidemic of obesity, of depression, of increased allergies, of ADHD, and wondering what is bringing all of this on. Because like you, when I grew up, it was rare. It was rare, but now it seems to be very commonplace. But
I think he's already winning. I think he's already winning because we're having conversations like this. People are being more aware, even before legislation and the laws are changed, that people are having these conversations. So he's already winning.
All right. Well, Dr. Frank, thank you so much for joining me today. I really appreciate your time and your expertise.
Thank you, Kel.